Hello, everyone. This is Dave Berta, news editor at Foresight Health. Welcome to Foresight Health's How Healthcare Revolutionaries Think podcast, where we get inside the heads of people trying to fix the healthcare system. Our guest on today's show is Dr. Alejandro Quiroga. Dr. Quiroga is president of Corewell Health West, based in Grand Rapids, Michigan. Before becoming president in April, Dr. Quiroga was senior vice president of population health for Spectrum Health. Spectrum is part of Corewell through its merger with Beaumont Health in 2022. Dr. Quiroga and his team have created a new system for segmenting patients by fee-for-service medicine and value-based care, and simultaneously and robustly treating both on two separate care pathways. I interviewed Dr. Quiroga as part of our How Healthcare Revolutionaries Think series, and I asked him about how being a nephrologist affects how he thinks about healthcare and how to lead change in the industry. Hey, Dr. Quiroga, how are you?
Good. How are you, David? Please call me Ali.
I will do that. Well, very nice to meet you, and thank you very much for making time for me today. I appreciate it.
No, my pleasure. Anything for people who's looking for revolutionary people in healthcare. This is kind of like my love language.
And I'm just curious about being a nephrologist. And I just know from my own experience or from people that I know, family and friends, kidney functions are a sign of so many other things that could happen. So it's always like that. Let's check the kidney functions, do the blood work. Okay, this says this and that. I'm just curious, does that affect how you think about healthcare and how it works as a system? Parts of it may work well, but other parts may not. I'm just curious about that.
Someone who works really closely with me recently told me that they thought that I was using my nephrology brain to solve some problems. And I thought that was an astute observation. Therefore, I also think it's a very astute question from your part. So specifically pediatric nephrologists, it is a very nerdy field. You have to understand math very well. You have to understand how very complex systems relate to each other. And you can never see something as an isolated process, just as you were saying. The kidney has to do with everything. You're filtering the blood, you're balancing the blood pH and chemistries. You have to do with everything. So yes, you do blood work, yes, you do imaging, but you have to do a thorough physical exam. You have to understand the context of that patient. And those are skill sets that are very transferable to thinking as a system leader. I'm diagnosis on a daily basis. What is this group of people are now working well together? I have to diagnose that. I have to read the literature about it and be very nerdy about the literature of human behavior, of complex systems, game theory. You have to understand what motivates people, understand what's going on. At the same time that you need to understand healthcare context, you need to understand health science outcomes and all of those things, and be able to come up to a diagnosis or a diagnosis path, a solution. So I think I like to think it that way, and I think it serves me well, and I enjoy it.
You have to get a T-shirt that says "Think like a nephrologist."
There you go. I love that.
Right? Hand that out to your team. That would be great. Well, Al, this has been great.
Well, I appreciate you. I appreciate you taking the time to just learning about our journey, learning about me and what we're doing, and highlighting us. We want to recruit people who care about this. So I appreciate your work. Thank you so much.
Sure thing. It's a good story to tell, Al. Thank you again.
Thank you, you too.
If you'd like to learn more about how Dr. Quiroga thinks, please read our Q&A with him on foresighthealth.com. Thanks for listening. I'm Dave Berta for Foresight Health.